morning, everyone, and thank you for joining us. My name is Haley Robertson, and I am one of the co-chairs for the USC Institute on Inequalities and Global Health Student Advisory Council. The Student Advisory Council began in 2018 as a way for students to gain unique access to and have an impact on the Institute's programming and opportunities. The council is now grown to a multidisciplinary group, including students from more than 7 different schools across USC. Council members meet once a month, and we discuss current and future programming to develop ideas and innovative opportunities for students like the one that you're attending today. The Student Advisory Council is really excited to have you join us for one of our Lunch and Learn series. Leading our training today is Avery Everhart, a PhD candidate in population health and place within the Spatial Sciences Institute. Her dissertation work is on global transgender health and human rights, and she is broadly interested in sexual and reproductive health and rights, spatial epidemiology, transgender studies, and the interactions between socio-legal and spatial determinants of health. She's incredible at navigating the distinctions between space versus place-based thinking and helping those from all backgrounds understand the basics of cartography and geovisualization. And with that, I'll turn it over for our presentation.
Thanks, Haley, and Gaia and Will and Sophia, everybody from the Institute on Inequalities and Global Health for having me. I'm really excited. I'm also super excited to see some friends that I recognize that don't even go to USC, so thanks for making time. Geographic Thinking and GIS for Global Health. I wanted to start with a land acknowledgement. Much of Los Angeles proper is on Tongva, Chumash, and Kij land. And we have this history, especially in California, of these unacknowledged treaties that were swept under the rug once California became a state in the middle of the 19th century. And those treaties haven't been honored. Much of the Los Angeles basin and this part of the part of Southern California that I'm coming to you from and I'm broadcasting from is part of Session 286. If you want to find out whose land you are living on, if you're in North America or in places that have been historically colonized by settlers, then you can go to this link, and I've shared a Google Doc as well in the chat that has all the links I'm going to use in the presentation if you want to review them. And there's a really, really great story map on the history of indigeneity in Los Angeles. It's also linked here as well if you want to look up more of that. It's not just focused on the history of how California was colonized, but also on Pacific Islander and other native diasporas within Los Angeles. Really, really important stuff, especially since we're thinking about geography and the way that space becomes place and how we make meaning out of the way we navigate the world around us. Which brings me to, what is geographic thinking? So first, and maybe this is potentially something that I just run into a lot as a geographer, I find that in such a broad field, there often is a kind of versus mentality. There's physical versus human. There's geographic information science versus cultural geography, quantitative versus qualitative. And I'm sure in your respective fields, be it public health, global health, or other fields, you run into this as well, where there's sort of divisions around what methods people use or their epistemologies and how they produce the knowledge through their data analysis or through their writing and their theory, whatever it is. And I really want to get away from that versus mentality as much as I can. So both of each of these in the versus setup are equally important. We need to know about the physical geographic world around us, including elevation, the types of topography and the environments that we navigate, in addition to, of course, human geography, which has more to do with how we have gathered ourselves as human beings, largely in cities, close to coastal areas or sources of water, patterns of migration over time, et cetera. And how also geographic information science tends to be pitted against more cultural geographic thinking that doesn't tend to use computational methods as much or as often or as in-depth. And the same with quantitative versus qualitative methods. They're all valuable and they all contribute something different. So if you showed up thinking that this is strictly going to be a GIS talk, it's going to be a hybrid of both geographic thinking in a more cultural and human sense, and also some GI science. So why does geography even matter? First and foremost, to hit on both of these points and get away from that versus mentality, empirical research is vital. We already know that if we work in the global public health world. We can write narratives, we can write grants, we can have abstracts and papers, and we can push the theoretical thinking, and it's extremely valuable and necessary. But at the same time, the other side of that coin has to be there as well. We have to have empirical research in order to legitimate the work that's being done, in order to keep track and monitor health outcomes and the social determinants of health for various populations and communities that we might be concerned with. And therefore, we are thinking about geography always already whenever we're doing health research, and honestly, whenever we're doing most kinds of research, because culture is geography. We don't really have a way of talking about culture or how we communicate as human beings or how we have organized ourselves as human beings across the planet without also talking about geography. And in public health in particular, especially in the US, where we have such glaring disparities in health outcomes and we have such entrenched health inequalities, we have this idea that your zip code or your postal code determines your health, that the biggest determining factor of your health outcomes, your longevity, your life expectancy, any of those things can be predicted relatively accurately with your zip code. Whether or not that's actually empirically true remains to be seen. It depends on who you ask, but this idea prevails. But we're going to see later why that means that we can't just use the tried and true methods. We can't just think only in terms of epidemiology and distribution of health outcomes or health conditions. We have to be thinking explicitly geographically. And of course, those determinants of health that are related to zip codes, that are related to where we live and how you're raised and how we as humans have organized ourselves, are deeply, deeply affected by these histories of spatial formation. Just a fancy way of saying, how have we come to organize ourselves as communities or as nations or as governments or as peoples in the ways that we have? And in the US and honestly around the world, we have really entrenched inequalities that can be traced back to settler colonialism and to plantation slavery in particular in the US. And so we have to be thinking explicitly about how those histories aren't always just history, that there are afterlives to the things, that settler colonialism is ongoing, that there are still treaties that haven't been honored, and that those things inevitably are affecting health outcomes for people that have had to deal with those histories. So then, to make the geographic thinking part of it a bit more explicit, we can turn to some core concepts in geography. First of those is space versus place. We tend to use them interchangeably, and by we, I think I mean public health people more than geography. In geography, there's a little bit of more of an attention paid to how they might be different. And of course, like anything else, it depends on who you ask in terms of how different they are or what makes them different. But space often tends to be imagined as something that has to be made meaningful, that has to have meaning projected onto it, or that has to be contextualized in some way. And obviously, we call it spatial science. We call it spatial analysis. We don't call it placial science or placial analysis. So space tends to be the focus in GIS because we need to enrich our understanding of a given area or a geographic phenomenon with data in order to make it make sense. Place then can be imagined as the result of meaning that's been made by how we as human beings organize ourselves and interact with the locations that we live our lives in. And here's just quickly three thinkers, all very different thinkers and spanning about a half a century backward, but Henri Lefebvre in 1974 famously argued that spaces, not just place, are socially produced through production. So he's a Marxist geographer, and he's especially interested in how labor is a way of socially reproducing space. So it's a way of thinking about how essentially markets and the way that people become sort of distant from the products they produce as working class people or the services they provide as working class people, and they don't see the results of that labor in profit or in capital, that sort of alienation vis-a-vis Marx leads to the way we imagine spaces. So for people who are more affluent, who have wealth, the world is their oyster, so to speak. Yves Foutoin in 1977 has a different take and suggests that place is security and space is freedom, or that the former represents attachment in some way, meaning has already been made and it is meaningful to you, and that the other is something novel. It's something yet to be imagined, yet to be created, yet to be carved out or constructed. And then much more recently, Catherine McKittrick, who I had the sheer privilege of working with during my master's, has a book from 2006 called Demonic Grounds, Black Women and the Cartographies of Struggle, in which she pushes us to reckon with how plantation slavery affected and continues to affect our understanding of how space and place are produced and reproduced. So I know this is like a very quick fire attempt at giving you a little bit of theory, but I don't want us to go in totally without any context. And I want those folks who aren't more on the empirical side to also feel like they have things to contribute, and that hopefully there will be things they can find in GIS science that can be useful for how we articulate these theoretical things and how space is produced. So from space and place, we can then think about scale, another core concept in geography. And there's three types that I'm going to talk to you about. The first is cartographic scale. This is tried and true scale whenever we're talking to people that are more focused on cartography. And all it means is a representative fraction, which is a scary word, and maybe mathematical expression is just as scary, but it essentially means how many inches or centimeters, depending on your measurement system, in the real world that have been condensed into 1 inch or 1 unit on the map. As an example, the US Geological Survey, where a lot of physical geographers will get much of their data, if you're based in the USA, often uses 1 to 24,000 as their scale, meaning that 1 inch on that map, if you have a normal 8.5 by 11 piece of paper, 1 inch on that map would represent 24,000 inches in the real world. Here's the rub, and here is why it's important to articulate cartographic scale as different from other kinds of scale, especially if you're a public health person who wants to learn geography, or if you're hoping to collaborate with geographers. Here's where it gets different. Zooming in, meaning going in for a closer look on a smaller area, increases that fraction and therefore increases the scale, which means that small scale in this context of cartographic scale says that the world appears smaller, so you can see more of it at once on your map. And the large scale means the world appears larger. You're much more zoomed in. And this is the opposite of how scale is used in most of global health. So if you've ever been collaborating with geographers and you said something about scaling up an intervention or something like that, you may have lost them for a second. We have to switch back and forth sometimes to make sure that we understand what's going on. But this one is totally different from how these other two concepts of scale that I'll talk about in a moment are imagined. And to give you a quick example, and I know you're going to ask, so I have it as a bullet point. It's a bivariate map, which just means it's showing two variables at once, the pollution burden versus asthma prevalence based on Cal and viroscreen data, and that data is linked in the Google Doc. The top image, we have a map at 1 to 1 million scale, meaning 1 inch on that map is 1 million inches in the real world. Then the bottom image, much more zoomed in, we can see a little bit more granularity. You may even be able, if you're really familiar with Los Angeles and you live here, to locate yourself on this map in some way. That bottom image is 1 to 500,000. And there's pros and cons to each scale based on the desired effect, of course, but this is just to illustrate what cartographic scale is and how it's different than these two types. So when we talk about geographic scale, it's a lot more similar to how we use scale colloquially. It refers to the size of a phenomenon or to an entity. And so large scale means exactly what we're probably used to thinking. It means how big it is in the real world, like mountains, the entire planet. And small scale might be more like county or neighborhood. And there's been a lot of emphasis recently in public health work on neighborhood level interventions or trying to map activity spaces and things like that. And that's more the type of scale that you're probably used to thinking about. And then thirdly, especially for quantitative geographers, we think about scale of analysis a lot. And this really for us is a way to talk about granularity of data, how fine of a level of disaggregation you can get, et cetera. So for raster data or satellite images, which are usually converted into raster data, which I'll speak about in a minute, it's about the resolution of the image. So just like if you're like me and maybe a little bit of an older millennial and you can remember taking photographs on your very first camera phone, you can't improve the quality without making up more pixels, essentially, which can be compared to another process of interpolation. But if you start with something that's much higher quality and is much more densely pixelated and has that many more pixels, you can always go a little bit less fine and make it have less pixels rather than more. And that's the same with granularity of data. For vector data, it's a lot more about the availability for disaggregation. So if I only have data that goes down as small as the county level for the entire country, for example, I'm going to have a difficult time if I want to plan where to put services, for example, within Los Angeles County because it's such a large space. I would want a much finer scale of analysis in order to be able to adequately tell where services are needed. So because I referenced vector and raster already, I'll go ahead and give you a breakdown of what those are. So this is the basics of GIS data format. Spatial data, just like any other data, should not be mistaken for the real world. It is a representation of the real world. And because it's a representation of the real world, we want more than one option in terms of how we represent it. So there are two basic types of GIS data. On the top there, you can see with these red arrows that we've got vector data. So on top we have polygons, then lines, and then points. And here it's showing boundaries, streets, and parcels. And this would be like if you go on Google Maps and you're getting directions to a location, it shows you point A and it shows you point B, and then it draws a line between the two. You started with 2 points and then you connected them to form a line. Those are the two smaller versions of vector data. Let's say you add a third location that you want to go to, point C. You're going to stop at the grocery store on the way home, and then you drive home back to point A from there, and the lines connect. Now you have a polygon. That's the foundation of vector data in GIS. In contrast, raster data tends to be much better for things that are continuous phenomena, that have less to do about human geography and less to do with how we've organized ourselves or how we navigate street networks, et cetera. And it's really good for things like elevation or comparing floodplains, things like that. And it essentially means you take an image, an aerial photographic image of some kind. It could be from a drone or it could be from a satellite, depending on what you're looking for. And you overlay a grid on it that looks like graph paper, where every little box and cell is the exact same size. And that way you are creating a way to more accurately measure across the entire image the distribution of different phenomena that you're looking at. But again, none of these are replacements for the real world. They're just ways of representing it. So then you might already be wondering, why does any of this matter? Why are spatial data special? And why should I care about how they work? And this may be especially useful for the folks who are trained in biostatistics or who are used to reading those types of papers and they're on the more empirical side. The foundation of statistical theory is that anything which occurs more frequently than what we can attribute to random chance is likely statistically significant. However, spatial statistics violates that rule or assumption at baseline. And it's because Tobler's first law of geography tells us that everything is related. Everything is related, but that near things are more related than distant things. So if in spatial statistics, we're explicitly trying to look at the role that space plays in our analysis of how things are distributed, be it where people are living, be it where health outcomes are, be it where services are located, et cetera, then we already have to rely on a different set of assumptions in order to make our analysis make sense, given that it's geographically explicit. So spatial data analysis has its own separate set of theories and methods that help us to better characterize the special nature of spatial data, which means that unfortunately, you can't just keep using zip code as a demographic variable the same as you would categorical things like age or gender or whatever it is. It has its own separate set of theories that need to be attended to if you want to do as in-depth of a quantitative geographic analysis as can be especially useful. So I've given a pretty rough, but brief and hopefully useful overview into some of the basics that you'll need in order to understand the next section, which is on cartography and geovisualization. And I probably, if you're here, don't need to talk very much about why maps are useful. If you're here, you're at least interested in maps in the abstract, even if not practically. But we like maps because they're visually concise. They usually are referential to the real world. We can make sense of them just by looking if we have some sort of landmark we can attach ourselves to. They often can contain and visualize more information than other forms of data visualization, like histograms or box plots or endless tables with a bunch of summary statistics. And they can be more aesthetically pleasing in that way. And they're able to illustrate both geographic and spatial patterns and aspatial patterns. So then, what makes a map a good map? When do we know that our geovisualization is working and is telling the story that we want it to? And to do that, to evaluate if we're creating good maps or if we're looking at a good map and we're telling the story that we want to tell, we can think about these 5 principles of cartography: contrast, legibility, figure ground organization, hierarchical organization, and balance. So this is the first part where we're going to get into a little bit of interactivity, because I want you all to get a chance to think on your feet about this. You're not at all required to participate, and I've already seen that there's been a couple of chats, so I'll check those in a moment while I pose some questions to y'all. But at least for these first 2 examples, I want y'all to think about what I'm showing you, and I'll ask some pretty directed questions about it. Feel free to chat or to unmute if you like, and weigh in based on the question. So in this section, I'm calling it Principles of Cartography in Practice, or How to Fix a Map. And if you look on the left, you'll see an awful map. It's really awful. I made it to be awful. It was actually kind of fun because my idea was to go, let's make it as bad as it can be. And then let's work backwards to try to fix it and show these different principles in practice, which is harder than it sounds. But the bad map part was the easiest part. What I'm using for this section is the 2011 Indian census data, specifically the 3rd gender data. So if you're unaware, both Nepal and India in 2011, when they did their census, had 3rd gender categories. India actually disaggregated everything for 3rd gender respondents to their census so that they have separate tables where you can do a different analysis with those. And that might be why, if you're familiar with India and you're looking in this sort of southeast corner toward the southern tip, you'll notice that these, what are now 2 states, are actually combined as 1, and that's because in 2011, they were still 1 state. And what I'm using from that 3rd gender data is literacy rates by state. For a more detailed analysis of this data and recommendations on how to better enumerate in the future, you can see Ayeshwarya Venkat's 2016 piece that I've linked. It's also in the Google Doc. And if you're totally unfamiliar, then 3rd gender just is exactly what it sounds like. It would be anybody who, when approached by enumerators for the purposes of the census, identified neither as male or as female, but in this 3rd gender category. And obviously, as somebody who's interested in transgender and gender nonconforming, gender diverse, 3rd gender populations, I want an excuse to pull this data and to give us a context that I'm assuming many of y'all might not be as familiar with. So here we go. First one. This time we've got visual contrast and figure ground organization. Visual contrast, I'm sure you can, from context clues, figure out what that means. Figure ground organization, we may stumble upon it in the process. So what's going to happen is I will show you the first map, and then I'm going to ask you to tell me what doesn't work with it. What would you change? What makes it difficult to understand? Or what parts of it you just don't like? And I'll maybe take some chats and maybe up to 2 or 3 folks commenting just for the sake of time. I see Caleb says, I can't see the legend at all. Someone else is saying it's monochromatic. I don't understand why the categories visualized are chosen. You can't separate the ocean from the continent clearly. The scale bar is unhelpful. The legend doesn't explain anything. These are great. Please feel free to drag this map because it is awful on purpose. But all of the things are entirely correct. You might even be going like, what legend? And if you don't know what a legend is, it's usually just a box that explains what the color codes or the symbols used on a map are. So here you can see that these colors correspond to something, but it's in white text. And we've got what's called a base map. It's all this background material that isn't the outline of the country of India. And it is not at all contrasted to the actual data we're trying to visualize. So it's not really helpful. You can't even really tell where the ocean ends and where the actual continent or where the land begins. In these instances, it's really difficult to tell, like, oh, do I not have this because there's no data, or is that because it's Nepal, or this is Bangladesh or Bhutan or whatever it is? Awful, all around. Here's what we can do to fix it. We've upped the contrast significantly. We changed that color of the background from a light gray into a much darker gray and black so that everything pops. And now we still have the same exact legend. Nothing has changed. It's still in white, but it shows up because the background looks different. We also had all of these floating labels, which were kind of in the way. I mean, they might be useful if you can reference and say, oh, here's Hyderabad, and here's Kolkata, and here's Kathmandu, and places that I might recognize. And they're good for orienting you, but they kind of were in the way of some of the data, and they flow over some of the boundaries, so that's not helpful. But now you can clearly see what each color corresponds to, and therefore we can see which states have the highest literacy rates among third gender people who were enumerated in the 2011 census. And even so, you may be wondering, like, this island is included, and this series of very small islands, that is not schmutz on your computer. That's actually part of the map, but it's very hard to visualize at the scale. But even those are color-coded as well. And this form of a map is called a choropleth map, which means it's just color-coded, essentially polygons. Or each of these boundaries can be called a polygon. Each state is a polygon. It's its own shape contained unto itself with nothing intersecting it. And they've been color-coded to correspond to the rates of literacy among third gender folks. So we have a much clearer figure ground organization as well. As someone said, you couldn't tell the difference between the sea and the continent. You couldn't tell the difference between the country and the sea and the continent. And here it's much more easy to differentiate. So all of that was fantastic. Please keep that up. I'm going to have you do it at least one more time. And I'm trying to keep an eye on time to make sure we have plenty to go off of our case study at the end. It'll be the most interactive part. So we talked about two principles already. Here's a third. This is legibility. It's exactly what it sounds like, but here's what it looks like in practice. This is an especially illegible map. Why? And what would you change about it? The text choices are confusing. The north area is almost impossible to see. I can't see anything. The way the data is communicated isn't intuitive. It's hard to tell. The size of the circles need to be way different. The size of the dots are all too similar. I can't see size differences. Dots too teeny. When I tested this out with some folks that are on the call, I won't call them up by name, they were like, well, my eyes are failing me. It's not that. These are bad. This has nothing to do with your vision. This has everything to do with a bad made map. So it's illegible because the thing that we're trying to display and visualize is third gender literacy rates. We can't see it, but we can fix that. So boom, the biggest thing that we've changed, in fact, the only real thing that we've changed is the color of the dots and the size differentiation between the divisions. Whereas here, these two on this size of map show up as almost the same. Even the third one, you can't really see a difference until you get to the fourth or the fifth. And maybe to some of y'all, they're totally indistinguishable, and that's fine. But here we have much more differentiation. And you'll also notice, interestingly, which you can see now that we've made it more legible, that often the higher literacy rates are actually in the states that have much less area. That's an interesting observation. That could be the foundation of something you'd want to explore with a spatial data analysis to some degree. And to somebody else's comment about the Indian data is too old, I will push back only to say that the census has not yet been repeated. It's not going to be repeated until 2021. So this is the most recent stuff that we have in terms of this particular thing that I was looking at, which is third gender respondents to the census. So while it may be old, it's the most recent that we have for this particular thing. So we've hit 3 of the principles, and for the sake of time, I'm just going to demonstrate the last 2 by taking us through them. And you can feel free while I'm talking about it in the chat to say, like, this is what sucks. This is how you made it bad. But the next is hierarchy of elements. This is pretty similar to something we've already seen, where the labels of the states are in the way. They're just not cutting it. They're hard to follow. They stick out as if they've been plastered over the top, and it doesn't really flow. And it's impossible in a lot of cases to actually see what otherwise might be a relatively decent differentiation in dot size because the labels cover them up. So it's helpful because you know you're looking at West Bengal, you know you're looking at Andhra Pradesh, you know you're looking at Gujarat, whatever, but you can't actually see the data. You can just see the labels. And this has to do with hierarchy of elements, because if we want labels and we want our data itself visualized, and we obviously need those boundaries showing so that we can differentiate between the states in the country, then we have a poor hierarchy when everything seems as if it's in the same plane, when the dots are covered up by the labels, because they're all happening at the same time and they're taking up the same space. Here's one way we could fix it. We change it from a dot map into a choropleth map. That could be called a dot density map, which is essentially like the size of the dot is proportional to the variable that you're visualizing. Here we switch to color, and we've made the labels very different. Now the labels only show up if they can be produced laterally, that is, or just horizontally, and fit within the individual outlines of the state. That's why some of them aren't actually showing up. Like Karnataka isn't showing up because it's too wide to fit in here, but it's still plenty in order for us to be able to orient ourselves to what we're looking at. And you can see that because of that, our labels are much easier to read. The differentiation in the variable that we're looking at, these literacy rates among third gender people, much easier to tell the contrast between them because they're not covered up. And this changed the hierarchy entirely. For our last one, in terms of principles, just to talk about balance of elements. This one on the left, some of you might be like, I don't know, maybe it's fine. And that's okay. That's okay. But the principle of cartography would tell us that it is out of balance in terms of its elements. And here's what that really means. If you look down here, we've got our title at the bottom, which isn't wrong in and of itself. You can have titles at the bottom, and in fact, you may want them there depending on the outline of the area that you're trying to look at. But it's a problem because it basically touches the southern tip of the continent. It also runs over this island. And then we have our legend, which is practically touching this state up here in the north. Our north arrow is too close. Our scale isn't all that helpful because it's kind of out of the way from most of the area that we're looking at. And everything's just out of whack and imbalance. Even though we can see the labels of the states and we can see the data that we're trying to visualize, everything's too smushed together. Here's how we could fix it. Move the north arrow over to the top left. Move the legend up further to the right so that you can go back and forth visually to glance at it when you're trying to see what the darkest color means. Move the scale bar down so that it's still useful. You want to be able to say, okay, West Bengal might be about 150 miles wide from east to west. And here we move the title down even further so that it's not covering up part of our continent or part of our country that we're looking at. And this is just an overall much more balanced map because we can see all of the elements clearly without feeling like there's no central visual focus. Here, your eyes might go to any of those elements on the left, but on the right, you know that you're meant to be looking dead in the center at the outline of the country of India. So thank you all for participating. I really appreciate it. And we're going to hopefully keep that up because I want to end by talking about something that if you've ever worked the geographic data, you have run into this in some way. It's called the modifiable aerial unit problem. And if it were up to me, I wouldn't call it problem. I would call it phenomenon because problem makes it sound like it's always inherently bad. And in reality, it's just something that happens and that you have to deal with. In the simplest terms, MOP just refers to a mismatch in the scale of a phenomenon and the geographic boundaries or units of analysis that you're working with. A really common example, though not the one we're going to work with in a moment, is when we try to represent continuous phenomena like air pollution or flooding or an earthquake, things that do not care about county boundaries, census tracts, any of that are just happening because it's the planet. It happens when we try to represent those continuous phenomena along the lines of how humans organize themselves, like zip codes or counties. And MOP can be in two different forms. It can be zonal, which means that if we change the kind of geographic unit rather than the size of the geographic unit, then we would change our analysis. And MOP can also be scalar, which means that when we aggregate, so combining smaller units into a larger unit, or disaggregate, breaking a larger unit into smaller units, that's what changes the interpretation of your data. So I'll show you an example for zonal MOP, and then I'm going to have you all in breakout rooms talk about scalar MOP with a case study. For zonal, here's what it looks like. This is Los Angeles County, if you're unfamiliar. If you've ever worked with the Department of Public Health, or you've ever worked with the Department of Public Health data, or you've even gone to the COVID dashboard and visualized, one of the options you have is not just by census tract, but also by service planning area. And they're exactly what they sound like. It's how the Department of Public Health for the county distributes resources based on these planning areas. On the left, we see the SPAs for LA County Department of Public Health, and there are 8. And on the right, a similar county organization, the Department of Regional Planning, has their planning areas. There are 11. You'll see the Antelope Valley looks very similar, except it goes much further south. You'll see that Santa Clarita and San Fernando, if you were to put them together, would make up the San Fernando on the left that the Department of Public Health uses. You can see that if you combine Santa Monica Mountains and West Side with the west on the left, that you would have roughly the same shape. And then we have Metro Planning Area, which is really similar to Metro and South. And then Gateway Planning, South Bay, and East San Gabriel, in addition to this one in the middle that I forgot the name of. But this may not be a problem unless these two agencies want to share data. Let's say that on the right, the Department of Regional Planning has a bunch of street network data that they want to be able to share with the Department of Public Health so that they can incorporate an analysis of availability and accessibility to public transportation as a social determinant of health. It might be difficult if they tried to use these existing units. So in this case, our modifiable aerial unit problem would be zonal because they have the exact same area. They have really similar number of divisions, 11 versus 8, but they're divided totally differently. And if they're trying to work together on something, they're going to have to find a different geographic unit to work with in order to be able to speak the same language and share data. So that's what zonal looks like. For MOP, for the scale version of MOP, I have a case study prepared that I'd like you all to get ready for the breakout rooms you're going to be talking about in a moment. And what I've done is taken some data, visualized it. I have a slider on it. You'll see it all in a moment. And I'm going to pose you some questions. But first, as a way of a background, Los Angeles County conducts a homeless count each year. So essentially an enumeration process, just like the census, and records that data all the way down to the census tract level, which is pretty fine. We could go smaller into census block groups or census blocks, but census tract is pretty good in terms of granularity. Additionally, the city of Los Angeles, the various municipalities within the county, and the county itself run what are called cooling centers that are supposed to be open during heat waves. And cooling centers are what they sound like. There's ice, there's cold water, there's climate control and air conditioning, there are fans. It's basically a place where you can get away from the heat, similar to how in the Northeast or places that get much colder, they may have like heating centers or places that you can go to when it's too cold in your home. In September of this year, we had a heat wave that lasted for 4 days. And the definition of the heat wave was when it gets above 95 degrees and stays there. And it was like that for 4 days. And I personally found that there was a woefully inadequate number of these cooling centers given the homelessness crisis and how many people are unhoused and how many people otherwise who might not be unhoused but might be living below the poverty line or might not have access couldn't get cool. And that can pose some serious dangers, which I'm sure you'll get to discuss. So you might have considered which geographic unit the city or the county might have used to plan these services. Often things are planned using city council districts. And you may have noticed that the 15 city council districts for the overall municipality of Los Angeles had about 5 cooling centers between them. And everything else was not a part of the municipality, and that some cities, smaller cities, were doing much better than others. You might have also talked about the capacity for each cooling center and if they accounted for social distancing. In case you're curious, per my calculations, the average capacity was only 32, and it was unclear whether that accounted for social distancing. And if you're curious, I also have some maps I could send along that show the homeless count data visualized by how many cooling centers worth of people who were unhoused there and how far they'd have to go to travel to those cooling centers. You might have also talked about how long and at what times those centers were open and what happens when they close, because they're not shelters, they're cooling centers. So were people just sent outside when they closed, if they closed? You might have considered how you would plan those services based on the data you saw. And I'm sure you talked about what other populations might be vulnerable to the heat waves that we didn't have data for, including elderly and aging folks, including anybody with chronic conditions, among others. I want to end by talking about a few things. First is further techniques. So one of the ones that I mentioned already was geocoding. That's what I did. It can be really simple or it can be really involved depending on what you do. But it essentially means you take the geographic information from data, be it zip codes, be it full addresses, be it census tract IDs, whatever, to spatially enable it using a reference system, and then plot it in a GIS, a geographic information system. Then there's spatial analysis, which can include a lot of things. Hotspot analysis to find clusters of where, let's say, more people have asthma, or clusters of exposure to lead in soil, et cetera, all the way up to measuring spatial autocorrelation, or geographically weighted regression, which is different than our bread and butter and much of spatial public health analysis of just doing regression, and even kriging, which is also can be really involved and is a unique technique to geography. And then, of course, acquiring and cleaning data. You have to know what you're looking for and where to look to find it. And then usually when you do find it, it is not in the form that you want. For example, the Indian census data that I found, it took me probably 8 hours to put all those maps together, largely because everybody wants the newest and freshest data. So finding more historical, even as recent as 2011 data, was difficult. So everything had those two states split as opposed to combined. But that's just a simple issue. There can be a lot of other issues that might require lots of cleaning. And it's a different process when it's geographic data that you have to clean, because you won't know if it worked until you map it. So beyond further techniques that you could look into, there are some data sources. So for global health, we often use things like the demographic health surveys. These are country by country. They vary from year to year. And usually there's at least one GIS file. And if not, you can always geocode it. If you never used those before, it will require you to register in order to access them. And I think they usually ask for an abstract of some kind, like, what do you plan to do for it? And you can even say something like, I'm a student, I'm learning GIS, I want to compare X, whatever it is. And you can look at the survey questionnaires, etc. There's also data.gov. That's where I pulled a lot of the data for the LA City stuff and the LA County stuff that I've showed. It also works for countries. I found it through data.gov.in, I think, or something like that for India. The World Bank has really great international data, especially if you're looking at socioeconomic trends or GDP, et cetera. And there's OpenStreetMap, another fantastic resource, which is especially good for street network data. And you should always have this saved. If you're interested in GIS data, it's free gisdata.rtwilson.com. Mine that link. It is fantastic. It is in the Google Docs. And then some further resources, which is where I want to end. And I believe someone asked this question, so I will get to an answer about what I use. But Quantum GIS, or QGIS, is a free-to-use open source GIS software that's similar to the ArcGIS suite of products made by Esri, runs off of Python. So that's the coding language that it runs on the back end, but you don't need to know Python for most basic level analysis. You can also use R, also open source, for a lot of spatial analysis now, and there's really great packages like FastStat, SF, Tidy Census, GStat, Map Tools. There's a lot. There's also the ArcGIS suite of software, which is proprietary. I used ArcGIS Pro for almost everything that I prepared today. What you saw in your breakout room is hosted on ArcGIS Online. And there are fantastic books on critical GIS if you're interested in those questions about housing justice, or how we can use community-based research methods in order to map inequalities and injustices, and how to correct those, and how to advocate at a more local level. That's really great stuff that happens a lot in critical GIS circles. There's also health and medical geography. I purchased the most recent version of the textbook on it that is fantastic. And I've been working my way through it just to make sure I'm on my toes about everything that's up and coming. There's lots of how-to manuals for specific GIS software as well, like the Getting to Know ArcGIS Pro series. And there's also really great ebooks on QGIS as well. But I'm going to stop sharing and say thank y'all again for attending, and hopefully you learned something new. But thanks, y'all.